The fluorescent lights hum over sterile hallways smelling of antiseptic and floor wax. Katie Rodriguez moves through her shift at St. Michael's in Colorado Springs with quiet efficiency, checking vitals, administering medications, her hand steady despite the slight tremor that appears only when she's alone. 3 months in trauma and nobody knows her name yet. Nobody needs to. She does her work and leaves before questions arrive. Dr. Pierce sweeps through the unit like a surgeon's blade, sharp, cold, precise in his disdain. She feels his stare before she sees it. He's standing in the doorway of room 347, watching her adjust and fall line with the concentration of someone who has done this 1,000 times. The needle slides in without hesitation. The drip steadies. She moves on. He doesn't. His eyes linger on her like smoke, present but formless, dismissive without words. Is the new girl finished with her tasks? He's asking the attending physician, not her. He uses girl the way other people use problem. Katie doesn't turn around. She strips off her gloves in one fluid motion, disposes them in the red biohazard bin, and exits the room as Dr. Pierce begins discussing staffing concerns with the attending. His voice carries the weight of institutional authority, the kind that comes from a pedigree written in old money and older names. Yale Medical School. A fellowship at Johns Hopkins. 23 years building a career on hierarchies he believes are as immutable as gravity. She is the gravity he's trying to defy. Katie has been a nurse for 8 years. 8 years of clinical competence, of certifications she didn't announce, of skills she let speak quietly while others spoke loudly. Before St. Michael's came a deployment to Helmand Province. Before that came 18 months of training that taught her how to move through crisis like water through a stone, shaping itself to necessity, never resisting, always flowing toward the outcome that keeps people alive. But that woman doesn't exist anymore. Captain Katie Rodriguez was officially erased the moment a Pentagon liaison handed her a sealed file and told her the operation was classified so deeply that her name, her service, her decorations would be locked away until she was old enough to die and take the secrets with her. So now she is just a nurse. Room 347 holds a recovering Navy SEAL general, the kind of man who has carried the weight of nations on his shoulders and somehow survived it. Katie has seen the paperwork. Major abdominal surgery 3 days ago. Recovery proceeding nominally. His eyes are the color of winter water, pale blue, deep as a well, sharp as broken glass. The kind of eyes that notice everything. She notices the tattoo the first time she enters his room to change his fore. It's on his forearm, beneath the hospital gown sleeve, a name written in black ink that has faded slightly with time. Her name? Katie Rodriguez. She stops moving for exactly 2 seconds. Her hands don't shake. Her breathing doesn't change. She adjusts the drip line with the same measured precision she uses for every other patient, and when she looks up, his eyes are watching her with polite blankness, the careful distance of someone who knows her professionally but not at all. He doesn't recognize her. The irony tastes like copper in her mouth. 3 years ago she carried him 3 miles through Helmand Province with a sucking chest wound that should have killed him before they made it 1,000 yards. His lung was collapsing. She had 12 minutes before the pressure differential in his chest cavity would stop his heart. She performed a needle decompression using a 14-gauge angiocath needle and a prayer that the Taliban wouldn't hear the hiss of air escaping. His oxygen saturation climbed from 68 to 88 while she moved through the dark with a man who weighed more than muscle and blood, whose weight was also responsibility, also the lives of the 15 other operators depending on both of them to survive the next extraction. He lived because she wouldn't let him die. The tattoo is proof that he remembers her. Just not as a human. Katie finishes her rounds without speaking to him again. She moves down the corridor toward her locker, her steps quiet on the tile floor. The trauma unit is packed today, for critical patients, 2 post-ops, 1 admission waiting in the ER. The chaos of it is familiar, comforting in the way that only necessity can be. There is no time for thinking when there is this much work. There is only action, only the next patient, only the breathing and the bleeding and the vitals that climb or fall based on decisions she makes without hesitation. Her locker is in the break room, a small metal rectangle in a wall of identical rectangles. She opens it and sees what she always sees, her spare scrubs, neatly folded, her phone, a pack of gum, and underneath everything, wrapped in plastic and then in tissue paper, the flag. A folded triangle of navy blue with 13 white stars and 7 red stripes. It's from a memorial service she wasn't allowed to attend. The team members were told their names would never be public. The flag was wrapped around by someone who understood that the dead still deserved honors, even if the living had to hide them. It belongs to a man named Marcus Chen. He was a petty officer first class. He was 26 years old. He had a daughter and a fiancée, both of whom would never know that the last words he heard were from someone who loved him, someone who pressed a hand to his chest and whispered that it would be okay, that they were almost home, that he was a hero even if nobody would ever know it. He died covering her extraction. That flag is the only proof Captain Katie Rodriguez had ever existed. It is the only evidence that she was anything more than just a nurse. The Pentagon has erased her service record. The decorations are locked in a vault. Even the men she served with have been ordered to deny knowing her. Official story: she was a combat medic attached to a unit that no longer exists. Unofficial story: she was never there at all. Katie runs her thumb across the folded triangle for exactly 3 seconds, then closes her locker. She washes her hands in the sink nearby. Cold water, soap that smells of industrial lemon, paper towel that dissolves under her fingers. Her reflection in the mirror is still just a nurse. Dark hair pulled back. Eyes that have learned not to show what they've seen. Forearms covered with a long-sleeved shirt despite the heat of the unit, despite the way the fabric clings to her skin and makes her sweat. There are scars on those forearms. They're thin, precise, the kind that come from shrapnel and broken glass and the moment a helicopter blades down 20 feet too close while you're running with a dying man in your arms. She got them on the same day she earned the Navy Cross, though nobody here will ever know that because the Navy Cross doesn't exist in her personnel file. It was never awarded. The ceremony never happened. There was a sealed envelope handed to her in a secure facility by a 2-star general who told her that her service was the finest he'd ever witnessed and that the nation owed her a debt it would never be able to repay, and that secrecy was the price of that service. She accepted the terms. Katie rolls down her sleeves and fastens the cuffs, and then she walks back to the unit because there are still patients who need her, and she is still just a nurse, and that is enough. It has to be. The trembling doesn't start until she's back in the trauma bay, and she channels it into motion, checking charts, monitoring vitals, adjusting medications with the steady hands of someone trained to perform surgery in the dark while explosions hammer the sky. The work is the same as it always is. The competence is absolute. The respect is completely absent. Dr. Pierce passes her in the hallway and doesn't acknowledge her. He's discussing something with an attending physician, his voice carrying the weight of institutional authority, his eyes fixed on middle distance where people like her don't exist. But that wasn't the worst part. The worst part was realizing that she'd accepted this erasure. She'd chosen it. She'd signed papers that surrendered her own name so that the operation would stay buried and the 17 people she served with would stay safe, and now she couldn't even speak the truth even if someone asked her directly. The general in room 347 would pass her 100 times and never know that the quiet nurse who changed his fur had carried him through enemy fire and saved his life. He would go home and tell the story of his survival without her in it. She would go home and not tell anyone at all. Thursday morning arrived like every other morning, fluorescent lights humming their mechanical prayer, the hospital waking to the smell of antiseptic and fresh coffee nobody wanted. Katie pushed a cart of fresh linens down the 3rd-floor corridor, her movements economical, invisible. 12 years of tactical training had taught her that the most dangerous person in any room was the one no one noticed. She'd learned to make herself disappear. She didn't know that Dr. Pierce had spent the night preparing her public execution. Grand rounds began at 8. The conference room filled with surgical residents, attending physicians, medical students, the hierarchy of St. Michael's assembled like a court. Katie stood in the back corner, arms crossed, watching Pierce arrange his materials at the front. He wore his white coat like armor, his silver hair like a crown. His presence had the quality of controlled menace, the kind that comes from knowing you've never had to raise your voice to make people afraid. Today we discuss documentation standards, Pierce began, his voice smooth as aged whiskey. Case studies in competency. Or the lack thereof. He clicked to the first slide. Her notes. Katie's charting from a trauma admit 3 weeks prior, clean, precise, every detail accounted for. She documented a GSW to the abdomen, vitals every 15 minutes, interventions logged in chronological order. The kind of notes that told the whole story. Observe, Pierce said, reading aloud. His voice made the word sound juvenile. Patient admitted with penetrating trauma, single gunshot wound left lower quadrant. Vitals stable. Abdomen soft, distended. Pain localized. He paused, looking at the residents. This is what happens when we lower our standards. Pedestrian. Unsophisticated. Listen to the language, soft, distended. A medical student could write this. A teenager could write this. The resident smirked like dogs sensing weakness. Notice the absence of nuanced terminology, Pierce continued. No mention of peritoneal irritation specificity. No graduated pain scale notation. Just basic vocabulary. Basic observations. He turned to face the room. This nurse writes for accessibility rather than accuracy. Noble, perhaps. But in trauma, we don't document for the patient. We document for other physicians. We document for the standard of care. And this, he tapped the screen, her words glowing behind him like evidence of failure, this falls short. Katie's jaw tightened. One measured breath. She felt the tears forming, but she wouldn't let them fall. Not here. Not in front of them. That was the rule she'd made for herself 3 months ago when Dr. Pierce first looked at her credentials and found them insufficient. The tears could come later, in the parking lot, in her car with the door locked and the radio off. But not here. A resident in the third row laughed, quick, nervous, seeking approval. Pierce smiled. He was enjoying this. The charting we aspire to, he said, advancing to his next slide, contains layered clinical reasoning. Sophisticated terminology. Evidence of critical thinking. He showed examples of his own notes, verbose, dense with medical jargon, impressive sounding and utterly unnecessary. This is the standard we maintain at St. Michael's. Not pedestrian documentation. Not nurse-level charting. Physician-level analysis. Katie's hands were steady. Her breathing was steady. But inside her chest, something ancient was waking up, the same thing that had kept her calm when insurgents were firing at her position, when she'd pressed her hand against a sucking chest wound and kept walking, kept dragging an injured SEAL through the dust while bombs fell around them like rain. That thing had a name. It wasn't rage. It was restraint. One tear slid down her cheek. She wiped it immediately, held Pierce's gaze across the room for exactly 2 seconds, then looked away. He needed to see that it didn't break her? He needed to see that she was still standing. The rest of grand rounds felt like a background noise, other cases, other discussions. Katie was already gone, already somewhere else. She'd learned compartmentalize and the way other people learned to tie shoes. You locked the door. You walked away. You came back to it later. 2 days later, Thursday afternoon, Katie's shift break coincided with a moment of weakness. She walked to the vending machines on the 2nd floor, inserted dollars into the coffee dispenser, selected the medium dark roast that tasted like burnt rubber and regret. The machine rumbled, dispensed a paper cup of something warm. That's when she heard his voice. The issue with egalitarianism in medicine, Dr. Pierce said, his tone carrying deliberately down the hallway, is that it confuses presence with competence. Some people mistake confidence for qualification. They think showing up punctually, following procedures, obeying orders, they think this makes them medical professionals. 5 interns stood around him like satellites orbiting a star. But there's a reason for hierarchy, Pierce continued. There's a reason we have medical school and nursing school, residency and fellowship. Because not everyone is capable of the same level of analysis. Not everyone possesses the intellectual tools. He paused, letting that sink in. Some people are tools themselves. They follow instructions. They execute tasks. But they don't think. They don't innovate. They don't belong in positions of authority or advanced decision-making. The interns exchanged glances. One laughed nervously. Katie lifted the coffee cup to her lips. The steam rose like a veil. She could see Pierce now, his profile sharp, his expression satisfied. He was performing for the interns, showing them how to properly dismiss someone without using their name. It was elegant in its cruelty. No one could claim he'd specifically attacked her. He'd simply shared his philosophy about competence and hierarchy. If Katie felt insulted, that was her projection onto his words. That was her problem. She walked toward them. Past them. The coffee cup warm in her hand, her stride steady, her face neutral. Pierce's words followed her like a shadow. She didn't accelerate. She didn't slow down. She didn't turn to confront him. She walked like a person who'd heard nothing. A person for whom his words had no power. But that wasn't the worst part. The worst part was watching his expression shift. He'd expected a reaction. He'd wanted one. That was the currency he operated in, emotional response, confirmation that his words had landed, that he'd made her small. And when she gave him nothing, when she simply selected a coffee and walked past like he was speaking to someone else, something flickered across his face. Anger, but also something worse. Uncertainty. The first crack in his sense of control. Katie understood the psychology of intimidation because she'd studied it the way soldiers study terrain. You establish dominance through response. You make someone react. You make them smaller. But if someone won't react, if they simply walk through your words like a ghost, then you lose the narrative. Then you're a person shouting at empty air. She took the stairs down to the 3rd floor, to the patient rooms, to the work that actually mattered. Her hand smelled like antiseptic and coffee grounds. Her heart rate was elevated but her breathing was controlled. 3 tours in a combat zone had taught her that fear was information. Fear was data. You acknowledged it. You filed it away. You kept moving. Later that afternoon, during a post-operative check, she assisted Dr. Pierce while a patient's family sat in the room, an older woman and her adult daughter. The patient was recovering well, vitals stable, incision healing. Katie noted the drainage output and quietly mentioned to Pierce that the drain frequency might warrant increasing to every 2 hours instead of 4. It was professional observation. It was medical collaboration. It was the exact thing she'd been trained to do. Pierce turned to the patient's family with the expression of a man who'd just been interrupted by a fly. "I apologize," he said, his voice dripping with sympathy that wasn't directed at anyone in the room, for the interruption. "Our nursing staff sometimes forgets their role in the care hierarchy." He turned to Katie with a smile that was all teeth. "Perhaps I should call hospital security to verify your credentials. Make sure you're actually qualified to be here. Make sure your background check was thorough enough for direct patient contact." The patient's daughter shifted uncomfortably. The older woman looked confused. Katie took one measured breath. She felt the tears coming, not from fear, but from something hotter. Injustice. The specific weight of being dismissed by someone who'd never earned the right to judge her. She let one tear fall and wiped it immediately, held Pierce's gaze for exactly 1 second, and then spoke to the family. "Excuse me," she said quietly. She walked out of the room with her posture perfect, her head level, the military training still visible if anyone knew what they were looking at. She could hear Pierce continuing his explanation to the family, his voice already moving on to something else. In the hallway, her hand shook. Not from fear. From the tremendous effort of restraint. Of holding back the 17 years of classified authority. Of not saying what would actually happen if a captain in the United States Navy decided to stop being a nurse and start being herself again. She made it to the supply closet, locked herself in, and let herself cry for exactly 2 minutes. Professional crying. Tactical tears. Then she wiped her face, fixed her hair, and walked back out to finish her shift. The tardiness warning was waiting in her mailbox that afternoon, perfectly centered on white hospital letterhead, dated for a shift 3 months prior. Katie stared at the infraction notice, her fingers steady despite the pressure building behind her eyes. Tardiness. Friday, June 14th. She'd arrived at 6:16 a.m. for a 7:38 a.m. start. For nurses had seen her clock in. Rodriguez, M. It read. The notation section contained a single line, pattern of punctuality concerns noted by attending physician. She folded the warning twice and placed it in her scrub pocket without showing her face to anyone in the break room. The fluorescent lights hummed their mechanical song, indifferent to the documentation that would now live in her personnel file. This was stage 2. Not loud anymore. Institutional. Pierce was weaponizing the system itself. Katie pushed through the afternoon with routine vitals, for placements, post-operative rounds. Her hands moved through each task with the same precision that had once kept teammates alive in Helmand Province, that same muscle memory that didn't require thought anymore, just presence. She checked the general's recovery chart at 1,400 hours. His wound was healing cleanly. His oxygen saturation looked good. His prognosis was excellent. He'd be discharged within a week, return to whatever life remained for a man who carried shrapnel in his shoulder and a name in permanent ink on his forearm that he couldn't remember belonging to. But that wasn't the worst part. The worst part arrived at 1,420 hours when Katie entered room 347 for routine vitals and Pierce was already there, his presence filling the small space like a tank idling in a garage. The general's family was visiting, his daughter, maybe 25, holding her father's hand while her mother stood by the window. Pierce had positioned himself at the foot of the bed, his expression arranged into the shape of professional concern, but his eyes were locked on Katie the moment she pushed through the door with the blood pressure cuff in hand. "Captain Rodriguez," he said, and the word captain came out like an insult. "We were just discussing your nursing license." Katie stopped. Her hand didn't move. Her breathing didn't change. The general looked up at her, his face still carrying the softness of morphine and post-operative rest, and there was nothing in his expression, no recognition, no flicker of acknowledgement. Just a sick man looking at his nurse. "I was reviewing this patient's intake documentation," Pierce continued, stepping slightly in front of the general. "And I became concerned about certain notations. I think we should verify your credentials with hospital security before proceeding with further patient contact." The family exchanged glances. The daughter's grip on her father's hand tightened. Katie could feel the moment crystallizing around her like ice forming on glass, the way her body would be read in this room, the way her silence would be interpreted as shame. She took one measured breath. Let her chest expand fully. Held it. Then she let the tears come. Just one. A single drop that traced down her left cheek, precise as a medical drip line. She didn't tremble. Didn't look down. Didn't break eye contact with Pierce. She raised her hand and wiped the tear away with the back of her wrist, her jaw set, and when she spoke, her voice was perfectly level. "I've been verified by people who matter more than you'll ever know, Doctor." She turned to the general without waiting for his response. "Sir, I need to take your vitals. May I wrap the cuff around your arm?" The general nodded slowly, studying her face with an intensity that lasted just slightly too long, as if something in her voice had moved through him like a sonar pulse. Pierce's jaw tightened. He made a sound, not quite a word, something between a laugh and a curse, and stepped toward the door with the careful precision of a man whose control was being tested and failing. But Katie couldn't tell him the truth. Couldn't say that the Pentagon had ordered her into this anonymous life 3 years ago, that Operation Sandstorm had been so classified that the entire file had been retroactively erased, that Captain Katie Rodriguez had officially ceased to exist on paper before she'd ever walked into St. Michael's. Her records were sealed. Her commendations were locked behind clearance levels that didn't appear in civilian institutions. The only proof she'd ever been anything more than just a nurse was the folded flag in her locker and the general's tattoo, and he didn't remember her enough to know what it meant. She wrapped the blood pressure cuff around the general's arm as Pierce lingered in the doorway, watching. The Velcro snapped softly, the only sound in a room that had become a stage for humiliation and restraint. Katie inflated the cuff and read the numbers, 138/82. Normal for post-operative recovery. The pulse beneath the general's wrist was steady, reliable. "How are you feeling today, sir?" she asked, keeping her voice level and clinical. "Good," he said. "Better than yesterday. The pain's manageable." Pierce left without another word. The family relaxed incrementally, the daughter releasing her grip on her father's hand. But Katie felt the weight of that moment settling into the architecture of the hospital, the warning in her file, the threat issued in front of witnesses, her single tear and her measured response all becoming part of the narrative that was being constructed around her. That evening, Katie found another document waiting in her locker during shift change. An incident report dated 2 days earlier, one she'd never seen before, that cited her for a charting error in the general's post-operative notes, complete with a supervisor signature from Dr. Pierce and a notation that further training is recommended. She'd been documenting his vitals with precision for 72 hours. She knew her own handwriting. She recognized the signature format. The report was fabricated. Over the next week, more documents accumulated with the inevitability of scar tissue forming over a wound. A patient complaint filed anonymously, claiming she'd been dismissive during a routine pain assessment. A policy violation notice citing improper infection control protocol in a procedure she hadn't even been present for. Each form was notarized. Each one cross-referenced to others, creating a documentation trail that made her competence irrelevant. Competence couldn't defend against a systematic architecture of lies, especially not when the system itself was being weaponized by someone with institutional authority. Katie carried these documents in her scrub pocket alongside the tardiness warning, each one a brick being carefully placed in a wall. She documented them all mentally, the dates, the signatures, the specific language of dismissal. Military training had taught her to observe everything, to remember everything, to keep perfect records of things that might matter later. What she didn't know was that the campaign had just begun. What she didn't understand yet was that Pierce had already drafted her termination paperwork, had already begun the conversations with hospital administration, had already decided that saving a life during a medical emergency would become the justification for destroying a career. 3 hours after the general crashed and Katie saved his life with a needle and steady hands, everything would change. But in this moment, Katie simply finished her shift. Clocked out. Drove home through Colorado Springs traffic with the folded flag sitting on her passenger seat, a physical reminder of the identity she couldn't claim, the heroism she couldn't acknowledge, the captain she was forced to be only in the places where no one was looking. The hospital didn't know. The general didn't remember. Pierce didn't suspect. And Katie moved through each moment with the kind of composure that comes from having already survived worse than institutional betrayal. That was her burden. That was her invisible strength. The shift clock read 1,420 hours when Katie Rodriguez entered room 347 with her vitals cart, the blood pressure cuff already looped around her wrist like a coiled snake waiting to strike. The general was propped up on 3 pillows, his broad shoulders wrapped in that standard-issue hospital gown that made everyone look simultaneously vulnerable and defiant, his laptop balanced on the raised bed table. He'd been recovering well since the thoracic surgery 4 days ago, wound clean, antibiotics working, pain controlled, the kind of textbook post-op trajectory that made Katie's job easier and her heart heavier because she still watched him every shift looking for any flicker of recognition and finding only polite blue eyes that looked through her like she was furniture. She approached his left side, the monitor side, and began the routine without speaking. Blood pressure cuff around the arm. Pulse oximeter on the index finger. Temperature probe under the tongue. The general didn't look up from his email, just nodded once in acknowledgement of her presence, the kind of distracted acknowledgement you give to room service. Katie's hands moved with practiced precision, the muscle memory of 3 years at St. Michael's layered over 18 years of something deeper, hands that had learned to read vital signs in a cave 30 kilometers from the Pakistani border where the only monitors were her own senses and her teammates' labored breathing. She wrapped the blood pressure cuff around his left arm and began pumping the bulb. But something shifted in his breathing. She felt it before she saw it, the rhythm changing from the steady 14 breaths per minute she'd logged that morning to something faster, shallower, like a man climbing stairs. His skin pallor shifted in that subtle way that civilians never notice but that combat medics see in their sleep. The oxygen saturation numbers on the monitor began their insidious descent, 97 to 95 to 93 to 91. Not dramatic. Not alarming to anyone glancing casually. Just a slow downward slide like a stock ticker in a bear market. "General Webb," Katie said quietly, her voice steady as a surgical laser, "tell me your pain level right now." 1 to 10. 5. 6, he said, finally glancing at her. "Why?" She didn't answer. She was reading him the way she'd learned to read men whose eyes were rolling back in their skulls, whose chests were heaving like broken bellows. His right lung sounded fine on auscultation that morning, clear, normal bilateral breath sounds. Now she could hear the faint absence on the right, as if someone had turned down the volume on a radio she'd been listening to her whole shift. The trachea. She looked at his neck. Subtle tracheal deviation, barely noticeable unless you were looking for it, unless you'd spent 700 days in a combat theater learning that deviation meant the pressure inside his thorax was climbing, that air was leaking into the space between his lung and his ribs, that gravity was slowly crushing his right lung from the inside out. Tension pneumothorax. His vitals chart showed what he was becoming, a man being suffocated by his own body at 1,423 hours on a Tuesday afternoon in Colorado Springs. Katie turned without speaking and moved to the supply cart mounted on the wall. Her hands didn't tremble. The trembling wasn't fear, it was restraint, the accumulated weight of 19 years of knowing exactly what she was allowed to do and exactly what protocol said she wasn't. Dr. Pierce had made that abundantly clear over 3 months of veiled insults and explicit warnings. She was a nurse. She could take vitals. She could change dressings. She could call a doctor. She could not perform invasive procedures. She could not make clinical decisions. She could not save this man's life with her own hands because the hospital hierarchy decreed that only physicians had hands that mattered. She grabbed the 14-gauge angiocath needle from the trauma kit. "What are you?" the general started. "Don't move. Don't talk." Katie's voice had dropped an octave. The timid nurse dissolved. She palpated his chest wall by feel alone, finding the second intercostal space at the midclavicular line through pure muscle memory, the anatomical landmark as familiar to her as her own heartbeat. She prepped the skin with one hand and positioned the needle with the other, the needle that was her only tool, her only weapon, the only thing standing between this man and his diaphragm crushing up against his heart. She'd done this once before. 14 months ago. In the dark. The needle penetrated the skin. Through the subcutaneous tissue. Deeper. Past the external intercostal muscle. The internal intercostal muscle. And then, the hiss of air escaping, the rush of decompression like a tire losing pressure, like the universe exhaling. The needle was in the pleural space. The pressure was releasing. The lung could re-inflate. She had no chest tube, so she left the needle in place and secured it with tape while the general's breathing slowed, while his oxygen saturation climbed back up the monitor, 89 to 91 to 93 to 95 to 98. She didn't look at him. She looked at the monitor. She watched his breathing normalize from panic gasps to steady inhalations, watched his skin color return from gray to something resembling human. Watched his eyes widen as he understood what had just happened, what she had just done. The code team arrived 40 seconds later, responding to the monitor alert that should have happened 2 minutes ago but didn't because she'd prevented the crisis before it could complete itself. The team leader was Dr. Margot Chen, an attending who'd never been rude to Katie, who'd never made her feel small, who understood that competence was competence regardless of pedigree. Dr. Chen looked at the needle, at the patched-up puncture site, at the stabilized vitals, and then at Katie with a kind of clinical awe that only medical professionals could muster. "You decompressed him," Dr. Chen said. "Not a question." "Tension pneumothorax," Katie replied. Presentation at 14:20. "I couldn't wait." "You saved his life." "That was textbook decompression." Katie nodded. She didn't smile. Smiling would have been acknowledgement of something, pride, relief, human emotion, and she needed to stay functional. She returned her attention to the general. "We're going to transport you back to radiology for a chest X-ray. You need a chest tube placed in the OR before this happens again." The general reached for her hand, but she'd already stepped back, already pulled off the gloves, already moved to the next task. Her adrenaline was flooding her system like an intravenous drip, making her feel simultaneously invincible and invisible. She'd just performed an emergency medical procedure without attending physician authorization. She'd just violated every protocol in Dr. Pierce's beloved Section 4.7.2. She'd just saved a man's life using hands and knowledge and 18 years of experience that her employment contract said she wasn't supposed to have. She returned to her charting at the nurse's station. Her hands were steady despite everything, the surge of adrenaline, the pounding knowledge of what she'd done, the absolute certainty that there would be consequences. Around her, nurses worked their shifts, monitoring their patients, making their careful decisions, living the lives they were allowed to live. Katie lived the life she was forced to live, competent but voiceless, capable but constrained, knowing exactly how to save someone's life and having to pretend she didn't. She was documenting the vital sign changes when she saw Dr. Pierce appear at the far end of the hallway, saw him track the general being wheeled out of room 347, saw his jaw clench as he realized what had happened without him. He didn't approach her. He didn't speak to her. He simply stood there, reading the situation the way territorial animals read challenges, and something in his face hardened into the expression of a man who had just realized that his control was slipping. But that wasn't the worst part. The worst part came at 1530 hours when Katie saw the incident report request appear in her hospital email inbox. The subject line read, "Urgent, unauthorized invasive procedure report, Section 4.7.2 violation." She didn't open it. She didn't need to. She already knew what it would say because Dr. Pierce had documented everything, had created the architecture of her undoing in the time it took her to stabilize a man's pneumothorax. Section 4.7.2. Unauthorized invasive procedures by unlicensed personnel. She'd read that exact protocol when she first arrived at St. Michael's, back when she thought protocols protected people instead of protecting hierarchies. By 1900 hours, when her shift ended, she'd received the summons. A message appeared on the electronic board in the break room, "Katie Rodriguez report to HR before leaving the facility." Not a request. A command. The kind of command that came with signatures and documentation trails and the kind of institutional weight that crushed individual people like insects. The HR manager's name was Susan Blake, a woman with tired eyes and the expression of someone who'd delivered bad news too many times and had learned to separate herself from the cruelty of it. The termination paperwork was already on her desk, forms stacked like a house of cards that was about to collapse directly onto Katie's career. "You're suspended pending investigation," Susan said, sliding the first form across the desk. "The complaint alleges you performed an invasive medical procedure without physician authorization. That's a termination-level violation." Katie read the report. It was meticulous. It was exactly the kind of documentation you'd create if you wanted to destroy someone slowly, professionally, in a way that no one could call unfair. Every detail catalogued. Every violation cross-referenced. Every timestamp verified. "I saved his life," Katie said. Susan sighed, the sigh of someone caught between procedure and justice and understanding that procedure always wins. "I believe you. But protocol is protocol. Dr. Pierce has documented a pattern of concern spanning your entire tenure." She opened a file thick as a handbook. "Tardiness. Patient complaints. Policy violations. Each form has been notarized and cross-referenced. This isn't new, Katie. This is a pattern. But they were lies. All of it. Fabricated dates and manufactured complaints and violations that existed only in Dr. Pierce's meticulous, vindictive architecture. Katie understood in that moment what had happened, that saving the general's life had shifted something in the power dynamic, had exposed Pierce's authority as something that could be transcended by simple competence, and that competence was the only thing he could not tolerate. Termination paperwork has been drafted, Susan continued quietly. Your investigation will take approximately 1 to 2 weeks. During that time you're barred from hospital grounds except for HR appointments. I'll need your badge and your hospital ID. Katie turned in her credentials. She watched the manager place them in a manila envelope. She walked out of St. Michael's at 19:35 hours still wearing her scrubs because changing out of them seemed like admitting something was final. The drive home was silent. No radio. No phone calls. Just the sound of the engine and the knowledge that Dr. Pierce had moved from strategic attacks to active sabotage, that he'd weaponized every protocol in the hospital to transform her life-saving act into a fireable offense. She'd been at St. Michael's for 3 months and 2 days. She'd saved the general's life. Now she was suspended for doing it. At 1,630 hours, she sat at her kitchen table still in her scrubs, the fabric dried against her skin with the accumulated sweat of a shift that had started at 0700 hours with routine vitals and ended with her career in a manila envelope. She didn't know how long she'd been sitting there when her daughter came home from school, backpack first through the door like always, homework and chaos and the uncomplicated demands of childhood. Emma stopped in the doorway. She was 8 years old and possessed the kind of intuitive understanding that children have, the ability to read adult despair with perfect accuracy. "Mommy, why are you home?" Her voice was small. Frightened. "Why are you crying?" Katie hadn't realized she was crying. The tears had started at some point between driving and sitting, some point where she'd finally let herself feel the weight of it, that she'd saved a man's life and lost everything, that she'd done exactly what she was trained to do and been destroyed for it, that the general whose name was tattooed on his forearm didn't even know who she was, would never know who she'd been. She pulled Emma close and held her daughter against the still damp fabric of her scrubs. "Mommy got in trouble at the hospital, baby. They said I did something I wasn't supposed to." "Did you do something bad?" "No, sweetheart. I saved someone's life. But they said I did it wrong." Emma's small hand gripped the fabric of Katie's scrub top. "Can't you tell them you saved someone? Can't you tell them they need you?" Katie closed her eyes. From the mouths of babes came the most devastating truths. Yes, someone needed her. The general needed her. The hospital needed her. But needing and wanting were different things, and institutional power wanted her gone far more than it needed her alive. The incident report landed on Katie's desk before her shift ended. Not through official channels. Not sealed in an envelope with her name typed formally. It was placed there by a junior administrator who wouldn't meet her eyes, who mumbled something about procedural documentation and then retreated like she'd already been erased. Katie picked it up. Her hands didn't shake. Her voice, when she read it aloud to the empty break room, stayed level and precise. The charge was clear: unauthorized invasive procedures by unlicensed personnel. Section 4.7.2 of Hospital Protocol. The needle decompression she performed on the general while 3 trauma surgeons stood paralyzed, while his O2 saturation climbed from 62 to 89, while his heart rhythm converted from VTAC back to sinus, that life-saving intervention was now classified as insubordination. Dr. Pierce had CC'd administration. Risk management. The legal department. He'd moved fast, surgical himself, cutting off her oxygen before she could exhale. By 7 p.m., the documentation trail appeared in her personnel file like a forensic excavation. Tardiness reports from weeks she'd worked 16-hour shifts, marked as unscheduled absences when she'd simply clocked in early to prep trauma bays. Patient complaints that didn't exist, a woman in room for 12 claiming Katie had been dismissive, the same woman Katie had spent 40 minutes with, holding her hand through panic attacks while explaining her EKG results in language that finally made sense. Policy violations manufactured from whole cloth, improper PPE usage, contaminated technique, failure to follow chain of command. Each form notarized. Each one cross-referenced to others. It was a documentation obsession that would have impressed her if it wasn't designed to dismantle her. The architecture of it was flawless. Institutional murder. Pierce had assembled the paperwork like a surgeon assembling instruments, and methodical, precise, with the kind of calm that only comes when you know you're about to win. Each document supported the others. Each violation fed the next. It looked like Katie had been failing for weeks, when in reality she'd been saving lives while he'd been building this case against her, brick by brick, in the margins of his carefully curated authority. HR called her at 4:41 p.m. Not a meeting request. A directive. She was to report immediately to the third floor, Human Resources Department, room 347A. The universe's grim humor, room 347, where the general now slept peacefully because of her hands, was where Pierce had once threatened to call security. Now his paperwork was trying to call security on her from an adjacent room. The escort was the worst part. Not because of shame, Katie didn't shame easily, couldn't afford to, but because of what it signified. 2 security guards, neither with aggression in their stance, just protocol. Just procedure. Just the system grinding. They didn't cuff her, didn't even walk close. They simply walked her to the elevator in a silence that sounded like rubber on linoleum, like the absence of announcement, like the hospital pretending she'd never existed at all. The HR director, a woman named Stephanie whose email signature included 3 different corporate certifications, had the termination paperwork already prepared. It sat on the desk like a completed crossword puzzle, waiting only for signatures. The language was sterile, pending investigation into alleged violations of hospital policy. Suspension without pay, effective immediately. Security credentials revoked. Return hospital badge within 24 hours. The documents looked like they'd been drawn up 3 hours ago, which meant Pierce had filed his complaint before the general even arrived at ICU. Katie sat in the chair they offered. She didn't argue. She didn't cry. She didn't perform anything for an audience that had already decided the ending. She listened to Stephanie explain procedures and investigation timelines and her right to legal representation, and Katie thought about a night in Helmand Province when her patrol was ambushed and she'd covered a junior Marine with her own body for 4 minutes while rounds tore through her plate carrier. This felt smaller than that. Which meant it shouldn't have hurt. But Payne had never cared about scale. "You'll be notified of the investigation's timeline," Stephanie was saying. Her hands folded on top of Katie's would-be firing papers, a gesture designed to communicate regret. "We take these allegations very seriously." "I performed a needle decompression," Katie said. Her voice came out the way it always did when she was operating, technical, calm, stripped of emotion. The patient's lung was collapsed. The trauma surgeons were frozen. His O2 was dropping. "I did what any trained provider would do." "That's not how hospital hierarchy functions," Stephanie replied, and Katie understood then that there was no point in speaking anymore. The system didn't care about outcomes. It cared about order. And Katie had violated order by being competent, by saving a life without permission, by making men in white coats look small. The drive home took 40 minutes. Katie sat at every red light like the universe was composing a symphony of delays. The sky had turned the color of bruised fruit, purple and orange, and the kind of gray that comes just before a storm. She held the steering wheel at 10 and 2, a habit from high school driver's ed, before she was captain, before she was Storm 7, before she learned to drive hums through Kandahar province while rounds pinged off the armor like rain on a tin roof. Her daughter was on the couch when she walked in. 8 years old. Pizza rolls on a plate beside her? A math worksheet that Katie was supposed to help her with. All the normal pieces of a normal evening, which made coming home in scrubs at 5:22 p.m., with her hospital badge already off her neck, feel like a door closing in slow motion. Katie didn't know where to sit. The kitchen table felt right. It was the same table where she and her daughter ate breakfast, where there was still a space left empty by the father who'd decided he couldn't be part of a classified life. Katie sat there and pulled something from her locker at home, something she'd kept wrapped in a plastic grocery bag in the back of the hall closet, something she'd been too afraid to touch for 8 years. The flag. Folded into the ceremonial triangle that the Pentagon had produced for her, not for her daughter, not for any family member of the Marine who'd died covering their extraction. They'd given her the flag instead because she was the only family that had been allowed to exist. The only connection that was real. The rest of them were ghosts in classified files. She unfolded it on the kitchen table and it was enormous suddenly, a universe of stars and stripes that had covered a man named Roberto Chen, who'd had a mother in San Jose and a boyfriend in Oakland who'd never been acknowledged in any official capacity. The flag Katie had carried through Helmand, through surgery, through 8 years of being nobody. Her daughter appeared in the kitchen doorway. She was still in her school clothes. Her shoes were untied. She took in her mother sitting at the table in scrubs, crying without making any noise, her shoulders rigid with the kind of control that only comes from practicing restraint for decades. "Mommy." Her daughter's voice was small. Smaller than it should be, because children know in their cells when something has broken in the adult architecture of safety. Katie didn't wipe her face. She just looked at her daughter and let the tears exist. "Why are you here?" Her daughter asked it the way children do, with the perfect clarity of someone who hasn't learned to be diplomatic. "Don't people need you?" And Katie couldn't answer her. Not the real answer. Not the truth that some systems were designed to destroy people who saved lives without permission. Not the reality that the folded flag on the table meant Katie had been a different person once, that she'd been trained for a world of consequence and extraction, that she'd volunteered for things her 8-year-old daughter would never be allowed to know about. That Dr. Pierce had understood, somehow, that Katie was too dangerous to keep around. Because competence without deference was a threat to hierarchy. Because saving a life meant you might save someone else's. Because once you knew someone could do the impossible, you couldn't fire them without explaining how it had been impossible in the first place. Katie pulled her daughter close and held her without speaking. The flag lay on the kitchen table like evidence. Like proof that she'd been something once. Like a thing that mattered that the world had decided didn't exist anymore. Outside, the storm broke. Rain hammered the windows like someone was pleading to be let in. And Katie sat in her kitchen, holding her daughter, understanding for the first time that this was the true extraction, not the 3-mile run through Helmand province carrying a bleeding general, but this, coming home to something that needed her more than any institution ever could, and discovering that needing wasn't enough. The silence stretched between them, full of all the things a classified life couldn't say out loud. Her daughter didn't understand yet. Katie wasn't sure she did either. She only knew that her hospital badge was already off, her clearance revoked, her career suspended, and somewhere in room 347, the general slept peacefully in a lung she'd saved while Dr. Pierce composed his next memo. Before we go on, thank you for watching. Please hit like, it really helps. Subscribe if you're new. And leave a comment letting us know you're here. We love hearing from you.